So now we are done with viral hepatitis also. Let's move on to autoimmune hepatitis. Being an autoimmune disease, it will be more common in females. So autoimmune hepatitis is common in females and they'll have elevated serum IgG levels. And here it is going to be caused by various autoantibodies. So we have three types based on the various types of antibodies produced. So in type 1 autoimmune hepatitis, there is going to be anti-nuclear antibodies, which is going to be the most common antibody. Then we'll have antibodies directed against smooth muscle actin. So SMA antibodies is there, and that is the most specific antibody here. And other than that, we also have soluble liver antigen or liver pancreas antigen antibody. So this can also be seen in type 1. So other than that, we can have atypical P-ANCA as well. Okay, so these four antibodies are going to be present in type 1. While in type 2, you are going to have two Ls. So anti-LKM1 and anti-liver cytosol 1 antibody. So both start with L. So remember, type 2 is for L. So anti-liver cytosol 1 and anti-LKM1 antibodies in type 2 autoimmune hepatitis. So this anti-LKM1 subunit. So this against this LKM1, it is going to be associated with HCV infection also. And you also have anti-LKM2 and anti-LKM3. So of this, anti-LKM3 is going to be associated with chronic hepatitis D. Okay, chronic hepatitis D is associated with anti-LKM3, while anti-LKM2 is associated with drug-induced hepatitis. Okay. Then type 3 autoimmune hepatitis, you have anti-SLA. So this antibody can also be present in type 3 autoimmune hepatitis. So we have a constellation of microscopic features which are quite diagnostic for autoimmune hepatitis. So we use a scoring system for diagnosing autoimmune hepatitis. Out of that, one of the scores is given to the microscopic feature. So listen to the microscopic features carefully. So the first feature on microscopy will be hepatic rosettes. So in this, if you see, the hepatocytes are arranged in the form of a rosette. So like a garland, it is going to be arranged around a central lumen. So this kind of hepatic rosette formation will be there. And apart from that, you can also see lots of this lymphoplasmacytic infiltrate, right? So all of these dark nucleus in between are the lymphoplasmacytic infiltrate. So lots of this lymphoplasmacytic infiltrate can also be present. Apart from that, we are going to have emperipolysis. So emperipolysis is nothing but an intact cell is going to pass through another cell. So it is not a form of death. So the cell is going to be intact. The word intact is going to be important. So an intact cell passing through another cell is called as emperipolysis. And here if you see, this is a hepatocyte inside which you are seeing a lymphocyte. Here again there is a lymphocyte. So an intact lymphocyte is there inside a hepatocyte, which is called as emperipolysis. And thirdly, we'll have interface hepatitis. So interface area is nothing but the area in between the portal area and the actual hepatocytes. So suppose there is the portal tract over here and the central vein is here, and suppose the hepatic lobule is here. Okay, so this area, which is quite near to the portal tract, is going to be called as the interface area. So hepatitis in this area is quite important, because if this area you are having lots of inflammation, chronic inflammatory cells are there. So this is a bile duct, if you appreciate here. So this is a bile duct, this is a bile duct. All of these are bile ductules present on the portal tract. So from the portal tract, these inflammation has gone into the hepatocytes. So all these area are the hepatocytes, and here if you see, the hepatocytes are being infiltrated by the lymphocytes coming from the portal tract. So this is called as interface hepatitis. So these three features together is going to be the classical triad which we see in a autoimmune hepatitis. So hepatic rosettes, emperipolysis and interface hepatitis. So being an autoimmune disease, how do you treat them? You will have to do an immunosuppression, or later on you will have to go for a liver transplant only. Okay, so in autoimmune hepatitis, the antibodies are important, and other than that, the microscopic features are also important. Then we'll see about Reye syndrome. So Reye syndrome is also called as Jamshedpur fever, and it's classically seen in a young child. So in this young child, they'll give a classical history of a viral illness, and then the patient must have taken some aspirin. So some NSAID usage will be there, and after which the child would have developed some vomiting, rashes, and also some confusion, hypoglycemia, then elevated liver enzymes will be there. So when this kind of history is given, then you'll have to think about Reye syndrome. So the confusion here, the cerebral, it's going to be due to cerebral edema. So liver is going to be affected. So when the liver is affected, it is going to, the urea cycle will not happen properly. So ammonia is going to be accumulated, which is going to enter the brain and cause this cerebral edema. Okay. So these classical features will be given in a child after aspirin usage. So what are the features of Reye syndrome? You will have classically microvesicular steatosis. So diffuse microvesicular steatosis. So in this image, if you see, literally every hepatocyte is having lots of vacuoles in their cytoplasm. So it is called as microvesicular steatosis. And on electron microscopy, if you see, there is going to be pleomorphic swollen mitochondria. So these are all the mitochondria. So they are variably sized. Some are small, some are large, some are of this shape, some are of that shape. So this kind of swollen and pleomorphic mitochondria can be seen in Reye syndrome. Okay. So this again can be asked as an MCQ with the history.